Representative Cooper.
Thank you, Mr. Speaker. Ladies and gentlemen of the House, I rise in support of the pending motion. This motion represents fully a year or more of changes that we have made to the original proposal to expand MaineCare. In each instance, the change was made in order to meet the objections of people who felt for one reason or another that they could not support the proposal. We made a good faith attempt to meet every one of those objectives, but I fear that we were naive. First objection, that we ought to pay the hospitals first for their debt that they had incurred because of the way MaineCare bills were paid. Well, we were to do that. We did it. They were paid in full, although there were many competing priorities for that money. But we paid it. In fact, some members of this body told me that they would support expansion if we just took care of the hospital bill first. Well, guess what? They didn't. Then there was the waiting list, the infamous waiting list. Everyone here knows that the waiting list has nothing to do with MaineCare eligibility. Every single person on that wait list is already entitled to MaineCare. We're talking about special services that are extremely expensive, but totally necessary for their well-being. There's no question that those people need those services. But expanding MaineCare will have nothing to do with it. And an interesting sidelight, the governor the chief executive during his State of the State address to this body called out a young man in the gallery who is autistic and is supposedly on the wait list, and it was our fault that he wasn't receiving the services he needs. Well, I, like many probably in this body, received an email from his mother, and I engaged her in a colloquy in our email. One of the things I learned was, guess what? His son is not on the waiting list. He is considered by DHHS not to be disabled enough to even get on the waiting list. Now, that's not to say that he doesn't need those services, but it certainly has nothing to do with whether or not to expand MaineCare. A myth that has been used over and over again by the administration to divert attention to the question at hand. When we paid the hospitals their debt, we thought the problem was solved, or at least some people did. But in fact, the implementation of the Affordable Care Act has made their situation continually worse. Under the ACA, charity care is paid at a much lower rate and will continue to diminish. And that's because it was based on the premise that MaineCare would be expanded to the groups that we are now talking about. That's why Central Maine Hospital has a $7 million debt. And that debt will continue to grow unless the people that show up at their doors are paid under MaineCare. This program of expansion will not only help the hospitals, but will help the economy generally. Indeed, it's been estimated that it will add close to $70 million in job benefits to various people not only in the health care field, but in all the supporting industries that depend on that source of revenue. So we are really talking about improving the economy, improving the tax base of Maine, not costing it money. I've heard the excuse that we can't support this bill because we simply do not trust the federal government. Well, that's fair enough. We know Washington is in paralysis. But if we accept that argument for not expanding MaineCare, why not reject money for infrastructure, roads, bridges, VA, Social Security? Have they ever defaulted on any of those promises? Have they indeed ever defaulted on MaineCare and Medicare? No. So that, too, is an excuse that does not fly with me. I think the problem boils down to what one's image is of the MaineCare recipient that we're trying to reach. On one side, people see a deadbeat welfare cheat, somebody who uses his EBT to go to the liquor store. And indeed, there was a small fraction of violations such as that. There's no question that fraud occurs in just about every program that we have, but it's minuscule, and don't be fooled by that. On the other hand, will you believe that the typical face of the MaineCare recipient that we are trying to reach are people like Representative Berry's brother, who's an accident away from bankruptcy and devastation, or Representative Hickman's constituent who, through no fault of his own, has been plagued by illness and disability that render his life extremely difficult and treacherous, given the fact that he does not have MaineCare coverage. Which image is in your mind? I am from away. I've lived here almost 2 decades, but as a convert to being a Mainer, I have the passion and feeling deep in my heart that there is no harder working person in the country than Mainers. They work 1, 2, 3 jobs to support themselves and their families. Where does the image come of people trying to work the system, cheat the system? If they're out there, they're in very small numbers. The people that we are trying to help are your neighbors and your friends, and they are good people. And I would note that I agree with Representative Pouliot that the problem is cost containment. It's very much a problem in our healthcare system. But one of the things that I do like about this compromise that is now before us is that it does make a good faith attempt to control those costs. Managed care in Maine is not a new concept. It's been working beautifully at places like Martin's Point, where the approach is coordinated care, particularly for chronic diseases, an approach that keeps costs under control, helps people get well and maintain their health. This is not a newfangled idea. It is also not the managed care of the 1980s and 90s, where all we worried about in those days was health insurance companies saying no, no, no. Instead, it's a provider-driven approach to health care which brings the best care, the most coordinated care to those people. And I think it offers us the best chance of keeping a lid on MaineCare costs. And with that, I will end my remarks and hope that you will follow my light. Thank you.